The heart attack difference between men and women. Everyone thinks they know what a heart attack looks like. Seriously, close your eyes for a second and picture it. You're probably seeing a scene straight out of a movie, a man clutching his chest, his face twisted in pain, and then he collapses. That's the Hollywood heart attack, and it's burned into our brains. But what if I told you that for millions of women, this dramatic scene is a dangerous work of fiction? What if, for a woman, a heart attack felt more like a bad case of the flu, a bout of indigestion, or just a bone-deep fatigue that won't quit? These are the subtle, sneaky, and dangerous signs that get tragically ignored every single day by patients, by families, and sometimes even by doctors until it's devastatingly too late. This isn't about scaring you. This is about empowering you. Because the #1 killer of women isn't cancer, it's heart disease. So I want you to ask yourself and be honest, would you recognize a heart attack in your mother, your sister, your partner, your best friend, or in yourself? By the end of this video, your answer will be a confident, resounding yes, and that knowledge could literally save a life. The great misconception, why we get it so wrong. The image of the Hollywood heart attack is powerful, and it's everywhere. We've seen it 1,000 times. A high-stakes meeting, a heated argument, and suddenly the classic signs appear. A man feels a crushing pain in his chest, grabs his left arm, breaks out in a cold sweat, and everyone knows exactly what's happening. Help is called. There's no confusion. The symptoms are as clear as a siren in the night. And while this scene does show one version of a heart attack, this movie-made myth has created a dangerous assumption that all heart attacks look and feel this way. The truth is, that dramatic picture almost exclusively represents the male experience. This isn't just some interesting cultural quirk, it's a deadly public health crisis. Heart disease is the leading cause of death for both men and women, claiming a life roughly every 34 seconds in the U.S. alone. But here's the devastating difference. Because women's symptoms often don't fit the Hollywood script, they're more likely to be dismissed, misdiagnosed, and undertreated. One study revealed the harrowing fact that women are more likely than men to be sent home from an ER while actively having a heart attack. Let that sink in. The body is sending desperate warning signals, but because they don't fit the pattern we all expect, the alarm bells go unheard. Women often put off getting help, chalking their symptoms up to acid reflux, anxiety, the flu, or just the exhaustion of modern life. That delay is critical because in cardiology, they have a saying, time is muscle. Every minute that blood flow to the heart is blocked, more heart muscle dies. The tragic result is that women have a higher risk of death and major health problems after a heart attack compared to men. And the information we're talking about isn't based on random stories. It's built on solid scientific research from places like the American Heart Association, the Mayo Clinic, and Johns Hopkins Medicine. It's been hard-won, often by looking back at tragic outcomes for women and asking, what did we miss? What we've learned is that the biological differences between men and women run deep, right down to our cardiovascular systems, and most importantly, to the signals our bodies send when our heart is in trouble. Understanding these differences isn't just for doctors, it's essential, life-saving information for all of us. The classic heart attack, understanding the male experience. To really get the dangerous gap in heart attack symptoms, we first need to understand the classic version we've all been taught to recognize. This is the pattern more often seen in men. Let's break it down so we can see just how different the female experience can be. The absolute cornerstone is chest pain, medically known as angina. But pain can be a tricky word. Men often describe it less as a sharp stab and more as an intense feeling of pressure, tightness, or squeezing right in the center of their chest. A common description is feeling like an elephant is sitting on their chest. This feeling is persistent. It can last for several minutes, or it might fade and then return. It's a heavy, oppressive sensation that you just can't ignore. It feels deep, internal, and fundamentally wrong. This is the symptom that usually triggers the immediate thought that something is terribly wrong. From that center of pressure, the pain often travels or radiates. The classic path is pain spreading from the chest into the shoulders and down one or both arms, most famously the left arm. This isn't just a small ache, it can be a deep, nagging pain or even numbness. The pain can also radiate to the neck, jaw, or back. A man having a heart attack might feel a strange ache in his jaw, like a bad toothache or a tightness in his neck. This happens because the nerves from the heart and these other body parts share pathways to the brain, and the brain gets its wires crossed about where the pain is coming from. Along with the pain, a whole cascade of other symptoms kicks in, driven by the body's frantic response to a failing heart. Shortness of breath is common because the heart can't pump blood effectively, leading to a feeling of being unable to get enough air even when you're not moving. A cold sweat is another telltale sign, not the sweat from a good workout, but a sudden, clammy, drenching sweat that happens for no reason. Finally, lightheadedness or dizziness can hit as the struggling heart fails to send enough oxygen to the brain. Together, these symptoms create an undeniable medical emergency. Let's imagine it. Meet Mark, a 55-year-old accountant. He's in a tense meeting and feels a sudden, intense pressure building in his chest. He tries to brush it off as stress, but it doesn't let up. It feels like a heavy weight. A weird ache starts traveling down his left arm, and his collar feels too tight. He feels short of breath, and a colleague points out the sheen of cold sweat on his forehead. He feels dizzy, like the room is tilting. His colleague, who's seen this in movies and health ads, doesn't hesitate. He yells for someone to call 911. Mark's symptoms are so classic, so undeniable, that action is immediate. This is the Hollywood heart attack, and for Mark, its obviousness is what saves him. The silent epidemic, unmasking the female heart attack. Now, let's pivot to the other half of the population and a story that is alarmingly different. The word atypical is often used to describe women's heart attack symptoms, but that's a dangerously misleading word. These symptoms are only atypical when you compare them to the male-centric model. For millions of women, these symptoms are, in fact, they're typical. And here's the most crucial thing to understand. A woman can have a heart attack with no real chest pain at all, or the chest pain might be mild and not even the main event. Instead, her body might be screaming for help through a completely different set of signals. Let's get into the most common and tragically overlooked symptoms in women. It is vital to commit these to memory. First is an unusual or extreme sense of fatigue. This isn't just being tired after a long day. This is a profound, debilitating exhaustion that can come on suddenly. Women who've been through it describe it as feeling like they've just run a marathon when all they did was walk to the mailbox. This happens because the struggling heart can't pump enough oxygen-rich blood to the body. It can even start days or weeks before the actual heart attack. Second is shortness of breath. While men get this too, for women it can be the main symptom and can happen without any chest pain. It might occur while you're just sitting down or even lying in bed, feeling like you can't draw a full, satisfying breath. This is a direct result of the heart's inefficiency, causing fluid to back up into the lungs. Third, and this is one of the most misinterpreted signs, is nausea, indigestion, or vomiting. So many women and doctors write these symptoms off as a stomach bug, acid reflux, or food poisoning. The pain might be in the upper abdomen and feel like intense heartburn. The reason is that the nerve that services the heart also connects to the digestive system, sending confusing signals when the heart is in distress. A woman might reach for an antacid when what she really needs is an ambulance. Fourth is pain, but not always in the chest. Women are more likely to feel pain in the upper back, between the shoulder blades, shoulders, or jaw. It's often a duller, aching pressure rather than a sharp, radiating pain. She might blame a backache on bad posture or think a sore jaw is a dental issue. The location is different, the sensation is different, and so it doesn't set off the same alarm bells. Fifth, dizziness, lightheadedness, or even fainting can be key signs. When the heart's pumping is compromised, blood pressure can drop, and the brain gets starved of oxygen. This can lead to a sudden feeling of being unsteady, like the room is spinning, or even a total loss of consciousness. Sixth is a profound sense of anxiety or an overwhelming feeling of impending doom. This is way beyond everyday worry. It's a gut-level feeling that something is terribly wrong, even if the physical symptoms aren't obvious. Tragically, this is easily dismissed as just a panic attack, especially in women with a history of anxiety, causing critical delays in getting help. Finally, a lesser-known early warning sign is sleep disturbance. A woman might suddenly find she can't sleep through the night or is awakened by shortness of breath or anxiety. This change can be an early whisper from a heart that's starting to struggle. Now, let's go back to our story format. Meet Susan, a 62-year-old retired teacher. For the past week, she's been incredibly tired, so tired she needs multiple naps just to get through the day. She's also had what feels like bad heartburn and a nagging ache between her shoulder blades. She mentions it to her daughter on the phone. "I think I overdid it in the garden and ate something funny," she says. "I just feel like I have the flu." Her daughter tells her to rest and take an antacid. No one thinks heart attack because Susan isn't clutching her chest. She's just tired and feels sick. For 3 days, Susan rests, but the symptoms don't go away. This is the silent epidemic in action, a heart attack unfolding in slow motion, disguised as everyday ailments. The why? Biological and risk factor differences. So why are the stories of Mark and Susan so different? The answer is buried deep in our biology and in the different ways heart disease develops in men and women. One of the biggest distinctions is in the heart's plumbing. Think of the arteries that feed the heart as a tree. In men, heart attacks are most often caused by a big, obvious problem. A big plaque builds up in one of the main arteries, the tree trunk, and ruptures, forming a clot that creates a major blockage. Standard tests, like an angiogram, are great at finding these. But in women, the story is often more subtle. While they can get those big blockages, they are more likely to suffer from something called coronary microvascular disease, MVD. Instead of a single clog in a main artery, MVD affects the heart's tiniest blood vessels, the small twigs of the arterial tree. Here, the vessel walls are damaged and don't work right, so they can't supply enough blood to the heart muscle. This problem is spread out and notoriously hard to spot with standard tests. An angiogram might come back looking clean, leading to false reassurance, even as the heart is starving for oxygen. Hormones also play a huge role. For much of their lives, many women have a built-in protector for their hearts, estrogen. It helps keep blood vessels flexible and manages cholesterol. This is a key reason why men tend to develop heart disease risk about 10 years earlier than women. But this protection doesn't last. During and after menopause, estrogen levels drop and heart disease risk can accelerate. This helps explain why women's first heart attacks happen later in life than men's. Beyond hormones, some of the classic risk factors for heart disease just hit women harder. High blood pressure and diabetes, for instance, increase heart attack risk more significantly in women than in men. Smoking is also disproportionately dangerous for women. Even mental health conditions like depression and stress seem to have a stronger physical impact on women's hearts. Finally, there's a whole category of risk factors unique to women. Complications during pregnancy, like preeclampsia or gestational diabetes, aren't just temporary issues. They are powerful clues about a woman's future risk for heart disease. Conditions like polycystic ovary syndrome, PCOS, have also been linked to increased risk. For decades, these female-specific factors were largely ignored. Today, we know they are critical pieces of the puzzle. The aftermath and outcomes, a tale of two recoveries. The differences don't stop once the heart attack is over. The disparities continue into recovery, long-term health, and ultimately survival. The stats are sobering. Studies show that women are more likely than men to die within the first year after a heart attack. They also face a higher risk of heart failure or death within 5 years. So why this grim gap? It's a tragic pileup of all the factors we've just discussed. The single biggest reason is delayed treatment, because women themselves, their families, and even their doctors often fail to recognize the so-called atypical symptoms. Women wait longer to get help. They might explain away their fatigue or nausea for hours or even days. And since time is muscle, that delay means the damage to the heart is often more severe by the time they get to the hospital. Misdiagnosis is another serious problem. A woman complaining of anxiety and back pain is less likely to have heart attack jump to the top of the list than a man with crushing chest pain. This can lead to delays in getting crucial tests like an EKG. Women also tend to be older when they have their first heart attack. This means they're more likely to have other health conditions like diabetes, which can complicate treatment and recovery. Finally, there are differences in the treatments themselves. For years, most heart research and clinical trials focused on men. As a result, many of our best treatments were optimized for the kind of heart disease common in men, those big, single blockages. These treatments may not be as effective for the diffuse microvascular disease more common in women. Let's go back to our stories. Mark, with his classic symptoms, was rushed to the hospital where an angiogram found a 95% blockage. A stent was put in, blood flow was restored, and he was enrolled in cardiac rehab. His path was clear and fast. Now, think about Susan. After 3 days of worsening fatigue, her daughter insisted she go to the ER. There, she described her tiredness and backache. Initially, she was treated for indigestion. Only after she insisted that she felt profoundly unwell was a full cardiac workup done. It revealed she had indeed suffered a heart attack, but because of the delay, more of her heart muscle was damaged. Her recovery was longer, complicated by heart failure, and she faced a much more uncertain future. Her story is the devastating real-world consequence of this gender gap. Section 6. The Action Plan. How to protect yourself and the women you love. Knowledge is step 1, but action is what saves lives. This can all feel overwhelming, but we can boil it down to a clear, empowering action plan. This is how you protect yourself and become a health advocate for the women in your life. Step 1. Know your numbers and your personal risk. This is non-negotiable. Schedule regular checkups and specifically ask about your heart health. You need to know your blood pressure, your cholesterol levels, and your blood sugar. Track these numbers. And crucially for women, talk to your doctor about your reproductive history. Did you have preeclampsia during a pregnancy? Did you enter menopause early? These aren't just past events, they are vital clues to your future heart health. Step 2. Listen to your body and trust your internal alarm system. Do not dismiss what you feel. Let's make a definitive don't ignore list. If you experience one or more of these, especially if they are new or just feel wrong, it's time to act. Number 1. Unusual or extreme fatigue that comes on suddenly. Number 2. Shortness of breath, especially when resting. Number 3, pain or discomfort in your upper back, shoulders, neck, or jaw. Number 4, nausea, vomiting, or what feels like severe indigestion. Number 5, dizziness, lightheadedness, or fainting. Number 6, an overwhelming sense of anxiety or impending doom. And, yes, any pain, pressure, or squeezing in the chest, even if it's not severe. Step 3. Be your own strongest advocate, especially in a medical setting. Women are often socialized not to make a fuss. You must abandon that instinct here. It is far better to be seen as a difficult patient who is alive than a polite patient who is not. If you are having symptoms and think it could be a heart attack, say it. When you get to the ER, state clearly and firmly, "I am worried I am having a heart attack." Using those words can trigger a specific protocol. Don't let your symptoms be written off as anxiety or indigestion until a heart attack has been ruled out with an EKG and blood tests. Step 4. Know the emergency protocol. If you suspect you or someone else is having a heart attack, call 911 or your local emergency number immediately. Do not drive yourself to the hospital. Paramedics can start life-saving treatment the second they arrive. While waiting for help, if a doctor has advised it and you're not allergic, chew 1 regular-strength aspirin. It can help thin the blood and reduce clotting. We started with a simple image, the Hollywood heart attack. We now know that image tells only half the story. The most critical message to take away is this: a woman's heart attack often looks and feels profoundly different. It can be quiet, it can be confusing, it can mimic the flu, but it is no less deadly. Recognizing the more subtle signs, the crushing fatigue, the shortness of breath, the back or jaw pain, isn't just interesting trivia, it is life-saving knowledge. Heart disease doesn't have to be a silent killer. We can give it a voice by sharing this information. If this video opened your eyes, please share it. You have the power to put this knowledge in front of someone who needs it most. You could be saving the life of your mother, your sister, your partner, or your best friend. That simple click could stop a tragedy before it starts and rewrite someone's story from one of loss to one of survival. Subscribe for more health content that cuts through the noise and gives you the knowledge to take control of your well-being. For more in-depth information, please visit the websites of the American Heart Association or the World Health Organization. Thank you for watching and for taking this crucial step to protect the hearts of the women you love, including your own.